to surgery, you will receive a packet that goes over your entire postoperative pain management. On the day of surgery, I will perform a numbing block to the area to help with long-lasting pain control. When you're discharged, you'll have different pain medications to help with your pain over the next 2 to 3 weeks, as that's when the pain is the most worse. For the first 48 hours, I encourage patients to use ice to the area to help prevent swelling. 10 minutes on and 10 minutes off whenever you're awake. After the first 48 hours, you can transition to heat to keep the area from swelling. To keep the incision site clean, you do not need to scrub the area. Just let warm soapy water run over it whenever you're taking your shower and pat the area dry. Also, if you have any pets in the house, I encourage you not to let them sleep in the bed with you or to climb in your lap so as to not get the device infected. I also encourage you to use clean linen on your bed. After the first week from surgery, I encourage all my patients to start pulling down on the pump in the scrotum to get them used to the area. When you come into the office for your postoperative check, we'll start teaching you how to inflate and deflate the device. Taking a stool softener will help to prevent constipation from the pain medication. Over-the-counter stool softeners work wonders. For the first 3 weeks after surgery, I tell all my patients not to lift anything greater than 10 pounds to allow for all the incisions to heal appropriately. You're okay to shower, but I don't want you to submerge yourself in any body of water while the incision is healing. Once you are no longer requiring any narcotic medications, you're okay to resume driving. Usually that's about a week's time. As far as returning to work, depending upon what you do at work, we'll answer that question. If you have to do any heavy lifting, I don't want you doing that for at least 3 weeks. But if you're not having to do lifting, you could return to work as early as 2 weeks after the procedure. The typical recovery time is 3 to 6 weeks. If you develop a fever greater than 101.0, if you have any drainage from the incision site that is malodorous in nature, if you notice any severe swelling or redness or severe pain that's not controlled by the pain medication, those are all reasons to call the office and get in touch with me. All of your postoperative appointments should be made prior to your surgical date. However, if they're not, we will make an appointment for you to see our nurse the day after surgery in order to remove your Foley catheter and your drain, and you will see me back in the office within 3 to 6 weeks to go over how to use the device. As always, my goal is to get you back to intimacy as soon as possible. Within 3 to 6 weeks, most patients are using their device for intimacy. Remember, if along the recovery course you ever have any questions, always call my office and we'll get in touch with you.